In the medical world, if I go to a sleep center and my doctor sends me to the sleep center, odds are I'm going to end up with this, right? This is what you wore. This is a CPAP. Considered the gold standard, I understand that, because it's guaranteed to work, because it basically forces the air up through here down into your nose. A, I don't know if I would like the head strap. B, I'm assuming that most people might have a bed partner, and this is, and I talked to you about this being, this is very sexy.
Yeah.
But tell me your experience. Could you sleep with this on?
No, I couldn't sleep with it on. I just finally stopped using it.
So, but even though you knew you weren't sleeping, you knew your oxygen, you made a conscious decision. This was so miserable you couldn't wear it?
If I'm not going to sleep, I may as well be comfortable.
And now you have Dr. Moses' new appliance.
Yes, I do.
And comfort-wise, how does that work for you?
It's fine. I don't even know I have it on when I use it.
And you said to me, to be honest, you said it probably makes it 85% better.
Correct.
But the difference is that you'll
use it.
Wear it. And it's
correct.
Easy, simple to use. Any downfalls?
No.
How long did you wear this after it was prescribed to you?
Oh, I didn't even, it was a couple months before I saw Dr. Moses. I couldn't wear that within 2 weeks. I gave up.
Really? And if you went past, you told me that you wore your CPAP. You had the same thing, right?
Yes, I did. I wore it for maybe a couple months, and I just couldn't sleep because they had to turn it up so high. And, you know, you would gradually go up. When you'd fall asleep, you're fine. Then all of a sudden, you've got this air shooting out everywhere, and you'd wake up anyway.
What do you mean turn it up?
Well, it starts, everybody has a different number on the CPAP. It starts from 1 to maybe 12 or 13, which is the highest. I'm not sure exactly what the highest, but they had to turn it up pretty high. So you'd start low, because if you turn it on high, you're just sitting there, and you can't breathe. So it gradually goes up during the night, and then it stays up high. So then once you get to that high point, at least for me, the air started shooting out of the mask into my eye, down here, everywhere, and then you wake up anyway. And I figured, why should I have this on? Because it's waking me up anyway. So to me, for me, it defeated the purpose of me having a good night's sleep, because I didn't.
So I
found Dr. Moses through my dentist. I think he knows my dentist. And I came here, I was kind of apprehensive. I didn't know if I really wanted to do this. And so I figured I'm going to try, because I was driving to work in the mornings. I have an hour drive. And all I was doing was trying to stay awake. I slept 8 hours, supposedly. I would get up in my car. I would have pretzels. I would have lollipop. I would just concentrate on getting to work awake. And so, because I would find myself at stoplights, dozing off.
Just did you?
The same thing, yeah.
And it just, not so much for you?
Yeah.
Okay. So same thing, you guys were always tired.
Right. It kept me awake, and I noticed things. I said, oh, there's a sign over there. Oh, there's a sign over there. Holy cow, there's leaves on that tree. Because I wasn't concentrating on trying to get to work awake.
Is that a common experience? I mean, obviously oxygen is nature's drug. We talked about in the hierarchy of life, everything has a place. And we can live without food for long periods of time. We now know from some recent accidents, unfortunately, that the human body can make it without water for 15, 20, 30 days. But oxygen, 2 or 3 minutes.
That's right.
And the brain starts to die.
That's right.
So is what she's saying when she gets up, the reason she's so tired, is it because she's not getting oxygen at night?
That's the reason.
All right, well, take me through and tell me a little bit about your appliance and how you came and how it works. Is this the same appliance? Let's use the one with the... Is this the same appliance everybody has?
Yes. This is the... We have 2 versions in the laboratory. We're doing a little experimentation and growth, and he's looking for aesthetics. And so the latest version is in blue. And the point is that the apparatus on the sides, the flanges, hold the lower arch forward. The advantages are that we have increased volume of space for the tongue. The tongue can come forward to the lips, and we've increased volume of space in here by opening the bite vertically and by protruding the mandible forward.
Okay, now why is it important for room for the tongue? Because we're going to get into what most causes this the most.
In obstructive sleep apnea, the tongue collapses on the throat, blocking the soft palate, the uvula, or in some cases, the tongue can just drop back. So this would be a normal airway. The tongue can drop back anywhere from about here, hitting the soft palate and pushing it closed, blocking nasal airway, or it can just plop back and block oral airway.
Now you did tell me there are different kinds, so everybody knows there are different kinds of apnea.
Yes.
And
Central apnea, the brain just shuts off. That's a brain malfunction.
The majority of apneic events, the majority of sleep apnea or snoring even, is caused by
obstruction.
It's
the tongue.
And the tongue drops back because normally the lower jaw drops back, or
the lower jaw drops back as well. The lower jaw is the tongue is attached to the lower jaw right here in the front. So if the tongue drops back, the lower jaw drops back. A lot of people who have receding lower jaws have a smaller airway for that reason.
And so what does the appliance do?
The appliance brings the lower jaw forward.
And holds it forward.
And holds it forward.
Okay, now I want to ask you, because we've been looking at these, you have no lock that locks together.
Right.
You have no big rubber bulging thing that pulls my tongue out.
Correct. We're trying to create as much room for the tongue as we can. The more room we create for the tongue, the less likely it is to collapse on the throat.
I have different fears than other people. I don't like to be restrained, like you had the mask on. Or can I talk with this on? Can I drink with this on? Do you guys find that experience is it uncomfortable?
No.
Not at all.
You don't notice? Okay. Negative effect of it? Any bad? Okay. All right, so please go on. Sorry about. How did you get to that design? You told me you started and you tried one, you tried two.
I tried about 6, and the keys to me are that the locked anterior doesn't allow the tongue to come as far forward, and there are other designs that take up more space on the upper, and there are other designs that don't allow an open anterior so the tongue can get completely forward to the lips.
So even though the whole idea is you bring the lower jaw forward so the tongue comes with it, if in bringing the lower jaw forward you block anywhere for the tongue to go, the tongue can only go
so far forward, it goes back.
And then it goes back.
Yeah. You're limiting the forward movement of the tongue. That wasn't my intent.
Okay, now just because I want everybody to know I got to see yours this morning, they wrote it. This isn't guessing for you.
No, we don't guess. We have a different ambulatory device that we're using now, which I think is state-of-the-art. And in this device here, the patient has a chest belt, an abdominal belt, nasal cannula. They have a snorometer, a microphone that measures snoring. And with this, we measure blood oxygen and pulse rate. This also measures body position. So we get a lot of measurements.
And this is done where?
At home, in your bed.
Have both of you slept with this too?
Yes.
Can you sleep with it?
Oh, yeah.
It's kind of, yeah, I'm with you, but it's not too obtrusive. And the good thing is you're in your own home.
You're in your own home, in your own bed. And it's not as obtrusive. It's not something you want to do every night, but it's a great measurement tool. That's the alternative.
Now, you quit wearing it. You quit wearing it. You never wanted one. Obviously, if you wear this, it's going to work.
It's going to work.
It's going to blow you up. It's going to blow air down. What percentage of people, we have a very bad group here because they all quit. What percentage of people do you think actually wear this?
The literature and the studies that have been done, there's 20% compliance with this. 80% of the people don't like it and don't wear it.
Well, because I've had people tell me, I interview all kinds of doctors. I've had them tell me, no, this works better than the oral appliance. And you said, yeah, but the difference is to me,